care clinic. The purpose of this assessment to address that there are no confidential low-cost women healthcare clinics in the area of Center County, Pennsylvania. A couple things to understand. Those three criteria, women's, low-cost, and confidential healthcare needs need to be met before this assessment can be fulfilled. All healthcare providers also see men in the area, so there's no specific women's healthcare provider. There's only one Planned Parenthood, and it's it's a 50-mile radius. State College closed in 2007. State College is the big city in Center County, so there's not one within a 50-mile radius. There is the Pregnancy Resource Clinic, which provides low-cost health care, but it's faith-based, so you can't get any services that don't align with the Christian faith, and it's not confidential. They will call your parents if you're underage. What does a low-cost healthcare clinic do? Of course, they give contraceptives and they do gynecological visits, but they also do things like test for diabetes and have glaucoma counseling. And of course, they treat STDs and STIs because, as we know, women are at a higher risk of getting HIV and STDs, and of course, pregnant teens and already teen moms are also at that risk. So we're looking at the sample. It's about 77,502 women, or 50%, actually 48% of the county as per the Census Bureau. Where are we getting our information? We're getting it from the Census Bureau. We're getting it from Mount Nittany Hospital, CHNA, or the Community Health Needs Assessment. Every hospital does one every 3 years. This one happens to be in 2016. Obviously, various peer-reviewed journals and our 3 interviews, Kendra Getting, Mary, whose last name is withheld, and Ginny Poorman, who are all directors of a specific foundation. We're going to start with Kendra, who's the director of the Out of the Cold Center County. Out of the Cold provides a warm place for those who are abused and homeless to sleep at night. They see about 15 to 30 people a night, and half of them are women. But they can't the problem is they can't put women in a different room to sleep because their area is so small, so that makes for some inappropriate touching and some sexual abuse. Obviously, the perpetrators are punished accordingly, but women do come out of there with some sexual diseases and sometimes some STDs from being abused in the shelter or otherwise. If you are sick, you're taken to the hospital. There's no clinic, and there's no employed social worker, so you'll have to take the one that the hospital gives you. Ginny Poorman, who's the director of Hearts for Homeless Shelter, who provides homeless with daycare. They serve lunch, they serve snacks, and they give out toiletries. And with that said, 31.5% of the county is made up of poor women. So often Poorman runs out of women's sanitary supplies. So that's tampons and pads. And because there's only 500 square feet in the shelter, there's not much privacy for women to go to the bathroom and do the things that they would do in privacy or at a affordable healthcare clinic. And to Poorman's account, they sit in the same clothes all day, which is a hotbed for UTIs and STDs. And if you are sick, again, you're taken to the hospital, and there is no employed social worker there either. Back to Mary, who, again, her last name is withheld for privacy reasons. She's the director of Center County Women's Resource Center, which provides 24-hour help and hotline for domestic abuse victims. It also leaves asylum. It finds them safe homes, so they're not homeless, and almost 95% of their clients are women. It does not, however, provide any medical counseling despite the name. Again, no employed social worker, no employed doctor, and again, it sends sick women to the hospital. The key findings and common themes to all of this is that all women are sent to the hospital if they have medical needs and are quickly discharged without any adequate care. You know, hospitals have a lot going on, so they don't necessarily have the time to care for poor women with STDs. None of these resources are equipped to handle any sort of emergency, and most do not have access to STI and STD testing, despite their women going through things like rape and sexual abuse. What do we do, and what is the solution? Start a women's coalition is a good one. There's no active women's coalition that's happening right now. Women's health care has kind of been put on the back burner since 2007, and there's no town halls dedicated to this issue within five years. Of course, opening a new Planned Parenthood. Planned Parenthood has been around for 100 years. They know what they're doing. They know how to stay confidential. And there is a law in Pennsylvania. It's Southeastern Pennsylvania versus Casey. And it keeps Planned for abortion and other services especially confidential. I share the findings. I love meetings. I love to meet with these interviewees and with all my sources. Mary does not like public meetings, but I'm hoping if we could gain that trust with each other, we'd be able to meet with the board of trustees for all these foundations to talk a little bit about what a women's healthcare clinic can do and why we should fight to open one. Assessment key factors. Hindrances for me was this cause was near and dear to my heart, so I kind of stood on my soapbox and let subjectivity get in the way. But because of that, I learned how to take criticism on how to reframe macro social work. And because of all of that, I was able to find the right people to interview and learn how to make great decisions on how to formulate questions. Again, this is not an easy topic, so you really have to take that care when formulating questions. I also learned that macro social work is sometimes a small community and not a huge group. So it's not all women in the country, it's all women in Center County. But because Center County is really conservative and faith-based, it was really hard to find people to make that communication with. How this assessment helped me become a better social worker. It was a high difficulty level. It's really hard to find people to talk about such a touchy subject. And people often don't want to talk about what makes them uncomfortable. And this makes people really uncomfortable talking about women's health care and contraceptives and abortion. So macro social workers often wear many hats. I analyzed information with the CHNA and the Census Bureau. I did some interviewing and having compassion for all that played into this project. Compassion is a huge part of being a social worker. So I learned to be a researcher and an organizational leader and an advocate. And I think that's it. Here are my references, and I can't wait to see everybody else's presentations. Bye now.